In past classes, did we use the dream of the accused for anything? Does this look familiar to you? I don't think we did. I didn't use this in medical jurisprudence and medical ethics. The dream of the accused reminds us of legal issues and how important it is to obtain informed consent with our patients. And I don't think I brought the casebook of Sherlock Holmes. Did I? Did I bring Sherlock Holmes? This is the compendium of the Sherlock Holmes stories of Sir Arthur Conan Doyle. If I may I hand you the dream of the accused? And I'm going to ask you, if you will, please, just to tell us how many pages are in that book.
199.
199. So from 1 to 199, if we can, we'll say 200 pages essentially. In a paperback book published in the United States, there are approximately 200 words per page. So 200 pages, 200 words would be about 40,000 words. Is that right? So what I'm going to do is, I'm going to ask, please, from 1 to 199, what page would you like?
61.
Oh, okay.
I'm sorry.
I'm sorry.
Go for it.
87.
Okay, okay. If you want to go to 87, please, if you turn to 87. And in fact, my sense is we read left to right, so I think the left page is 86, is that right? And the right page is 87. If you look at the first line at the top of page 86, the first line at the top of page 86, silently at the top of the first line, I want you silently, please, to select the biggest word, the longest word, the most letters, the most syllables. That'll make this the most impressive. Silently. Don't tell me what it is, okay? And if you want to show that to your colleague, you guys can tuck that away, okay?
Just to be sure, the first line, not the first sentence.
Just the first line. Yeah, yeah.
What is it? Let's get this documented for sure.
And okay, and you had also said 61, is that what you said? Do you want to turn to 61 as well and do the same thing? How's that? Cover both? I want you to turn to page 61. Look at the top line, first line, and pick the biggest word, longest word, most letters, most syllables, silently. Tuck that away. Or let's do differently. Let's go to 60, because that's on your left, isn't it? We'll go to 60. Perfect. First line on 60, because we do read left to right. Silently pick the biggest word, longest word for that. If you got it, you okay? I have you close the book. I'll take it back. So we've got a couple of words there. Okay. Randomly selected. And then what I'll do is I'm going to ask, if I may, I'm going to have you just say stop at any time. Stop. Okay, are you satisfied with this page? I want you to look at the first word at the top of that page. Okay? Don't want you to tell me, can you see it? I cannot. Got it? Very good. I'll have you tuck it away in your memory. You okay? Okay. And now I have, if I may, I'm going to hand, thanks. I'm going to may I hand you the book? I'm going to ask you, please, in a moment, I'll just have you crack the book open to any page you want. And then I'm going to ask you, when you do, please do not select a name, okay? Because it's usually Sherlock or Watson or Holmes. So please don't select a name. Don't select the first line or the bottom line, but just go through the body of the text and silently select the biggest word, longest word you find. Silently select a word, and once you do, just tuck it away. And then I'm going to ask you, if you will, you okay? I'll have you stand up. I'll take the book back. Perfect, because I'll have you remain standing. I'm going to hand you the book. I'm going to ask you to do the same, just to crack the book open to any page you want, silently, not the first line, not the bottom line, not a name, because we know it's going to be Sherlock Holmes or Watson. I'd like you then, please, to silently select more than 5 letters or 6 letters, because it makes it more impressive, a long word. And once you've got it, just tuck it away. Not first line, not bottom line, not name, just a word. Once you've got it, just tuck it away. Got it? And then I'll have you hand the book, and I'll have you stand up. I'll have you hand the book down to someone else. Great. I'm going to have you do the same. Just please crack the book open, select a word. okay? Not first line, not last line, not a name, longest word, and then I'll have you stand up. And then I'll have you hand the book, if you will, to one more person. Have you stand up and okay, okay, and I'll have you silently select a word, and then I'll just take the book back. Very good. Okay, you were saved by the bell. Now what I'm going to do is I'm going to ask you all, please, I'll start off here. I want you all, please, to silently think of your word and just spell your word over and over in your mind, silently, okay? I am going to do my best to pick up on the words you all are thinking of and spelling over and over in your mind. Don't do anything yet until I share with you what I want you to do. I'm picking up on throne, presence, mourning, and belt buckle. If I selected your word, please sit down. Oh my God. Thank you. And now, two pages were given at random. You all selected then 2 words, am I right? I want you please to concentrate on your words, spelling them over and over in your mind. There was 60, 61, and was it 86 and 87, something like that? Okay. The first word you all looked at reminds us that when we intervene to treat, we want to do so appropriately. We want to do so in an organized manner. Notice we talked about motivational interviewing, and we need to do so D-E-L-I-B, deliberately. Is that right? That was the first word you looked at. And we want to remember that when we're doing motivational interviewing, we want to do so in a way that takes into account the patient's resistance until he or she is comfortable with treatment. And so we need to modify our approach so that we engage in ACCON, accommodation. Is that correct? And the word that you're thinking of, you selected a word totally at random. The word that you're thinking of reminds us that when patients are engaged in illicit substance use and abuse and addiction, all too often they find they have to go to the street and they are engaged in procuring their illicit substances in a market that we know of as the UND underground. Is that correct? Thank you all very, very much. Pleasure to be